Okay, my video froze for some reason. Yeah, can you see me?
Yes.
Hi. Okay, folks. There's been an emergency situation on my end. There's no electricity in my house. What the hell, UPCL? But nonetheless, I'm actually sitting on my terrace, and this is my sister's area to decorate. So if you can see like big hearts and other stuff over here, it's because I am not in the place I usually take these sessions, and I just had to run out quickly. And if at any point my video disappears, please know it's because I don't have a stable internet connection right now. But nonetheless, this session has been much awaited, and because I was really looking forward to this session, somehow made it work, barely catching my breath, and here we are. So welcome, and thank you so much for joining us.
Thank you so much, Anjali. I'm so delighted to be
Bhasker,
back. Thank you.
Thank you so much for being here.
Thank you. I think Anjali has been locked out again. She's probably having some internet issues. We can probably wait a little bit for her to come back. Or maybe until she comes back, I can just update you about what we will be talking about today. So we're going to be talking a little bit more about obesity, and I think Anjali is back.
Okay, hi, my apologies. So I'm going to do something that I've never done in my life before, which is take this live from my terrace while I'm walking with my phone. Dr. Bhasker, please be on board with this. I'm really sorry about this entire mess. But can you hear me?
Yes, we can hear you, and it's absolutely all right. And I think it's a good change to see you walking around.
Thank you. I'll actually turn to this side because you'll be able to see some wheat fields at the back. Hopefully that works for people. Yeah. All right, folks. I'm going to do my pitch about Fuchsia now. For those of you who are new here, Fuchsia is a women's networking community, and we are a global talent showcase platform. We actually believe in women empowerment, but we want to make it happen through bringing together different genders and making sure that we are united for a common cause. And for this purpose, we do it through financial independence, learning and education, building relationships, and of course, an important part of which is also wellness. As a part of the wellness series, you are joining us for a live session with Dr. Aparna Govil Bhasker, who will be discussing the effects of obesity on your body. And it's interesting because so far we have talked about body image, we have talked about how to fight obesity and all these topics. But when we are actually discussing the topic for this time, it was Dr. Bhasker who said we need to talk about the effects that obesity can have on different parts of your body. And hence, we wanted to make sure that you have the right kind of information and that we have an open and expert conversation over here. For those of you who have even been with Fuchsia for the last 3-4 months, Dr. Bhasker is no stranger. Dr. Bhasker is a laparoscopic and bariatric surgeon. She's been working for the last 14 years. And not to mention, she's an expert and one of the leading people in this field in the country and possibly in the world. But what I love about Dr. Bhasker is that with everything that she's doing with her own practice, she also manages time to raise awareness. And I see her everywhere. And I have no idea how you do it, Dr. Bhasker, but kudos to you. And thank you so much for being with us today.
Thank you so much, Anjali. And this topic is really close to my heart. I do believe that there is a lot that needs to be done to raise awareness about obesity and our mindset towards obesity, because we still feel that obesity is still, just today I was having this conversation with a few of my friends, and we said that the fight is basically between, establishing it as a disease versus something which is just seen as a cosmetic inflictment even now. So it's not only in the minds of the people, but it was also with insurance companies and with, every aspect of the healthcare system, where we start from awareness of people to the highest places in the healthcare system, where we had to really fight for obesity to be recognized as a disease. And as we talk about it in this particular episode today, you will realize that how serious a problem it is and how complex a condition this is, which affects each and every part of the human body. And we talk about everything else, how it affects all of us in terms of body image and psychological aspects, but physically it affects all of us, all of our organs. There's nothing which is left, which obesity and cancer, I think, are two diseases which are very, very parallel, but which have you can imagine the kind of sympathy that a cancer patient gets, and absolutely no sympathy that a person who suffers from obesity gets. So so that is a difference.
Oh, yeah, absolutely. I think while a cancer patient might receive a lot of empathy and a lot of compassion, all that people with obesity receive is a lot of judgment and a lot of unsolicited, harmful
Yes.
advice. So, us
Yes.
talking about this becomes all the more important. And just getting started with our first question now, Dr. Bhasker. Height, and is there an ideal weight or height? Because I did a basic Google search. If you just Google what is the average weight, what is a healthy weight for someone, it's also differentiated, from country to country, from origin to origin, from gender. So could you provide us some clarity in this aspect?
I'm sorry, I lost you in the beginning. So you said, is there an ideal body weight and ideal height?
Yeah, but and what is the correlation between weight and height?
Yes. So see, we have something called as Broca's Index, and normally, on an average, for lay people, I think एक बहुत ही मोटा मोटा हिसाब लेके अगर हम चलते हैं, so if we take a height in centimeters, we would, on an average, subtract your height in centimeters by 100 to get the ideal body weight for men, and by 105 for getting the ideal body weight for women. So, say your height is 165 centimeters. If you're a man, your ideal body weight should be approximately around 65 kgs. You can say around 5 kgs plus minus. And if you're a woman, then it should be around 60 kgs. Okay. But of course, this is not absolute and this is not exactly correct. But yes, this is average what it should be, and it is good enough for lay people. There is no ideal body weight and ideal height as per a particular kind of population. But if you must have seen recently, there was a news about reference weight, which is there for a country or a geographical region. So where we would have a reference weight for a particular country, or because in a particular country you would have a particular kind of diet. Now, Indian diet is very different from a Caucasian diet or an American diet or European diet or say any other kind of diet. So we would have a different reference height and a different reference weight as compared to other countries. But it's not like ideal height or ideal body weight. Now, coming on to defining obesity, that is very simple. So that is defined with body mass index. Again, it may not be the most perfect way of defining obesity, but it's the easiest, the cheapest, and the most convenient way of defining obesity today. So this is a very, very basic formula, which is weight in kg divided by height in meter square. It's available on the net freely. You can calculate it yourself. If you know basic mathematics, you have a simple calculator. You can just do it by yourself. So weight in kg by height in meter square, whatever figure you get, if it is between 18 to 23.5, that means you fall in the normal weight category. 23.5 to 27.5 would put you in overweight category. 27.5 and above would be in obese category. And that also we have grades. So there would be grade 1, grade 2, and grade 3. So up to 32.5 would be grade 1. Up to 37.5 would be grade 2. Anything above 37.5 is grade 3 obesity.
Okay, all right. Because I did actually check my BMI today, and I think it was 24.7.
Yeah.
And yes, I think this is still okay. But I'm still exercising.
Yes, it is still okay. But for Indians, 23.5 and below is normal weight category. So you may still need to get your BMI down by 1 or 1.5 points, because
Okay.
I'll tell you the reason behind it. It's very interesting, because Indians have much more fat percentage as compared to Americans or the white population, the Caucasian population. So if you see Brad Pitt or Angelina Jolie or any of these Western movie stars, their body fat percentage is much lower as compared to us. So you would see that Brad Pitt in his fittest state of health would have body fat percentage as low as 6%. Whereas for us to get down to like for women, it would be anything between like around 30% or so for us, and for our men also it's about 20%. So that's the difference. So even though we may be looking thin, but actually we are internally fat. So we have a much higher fat percentage as compared to the American or the Western population, and that is the reason which makes us much more prone to getting diseases like diabetes, because it's the fat which makes us prone to getting all these diseases. And that is why today India is the diabetic capital of the world, and we have so many people who are suffering from diabetes.
Yeah, and I mean it's actually a very good insight. I also wanted to check because we are talking about different types of bodies and weight over here, and this is like a digression. Does it also make a
Yes.
difference if you actually take your weight right before your periods for a woman and right after it? Because I've heard that women gain perhaps maybe one or two.
Yes, yes. Because that's because of water retention. And don't freak out if you see that suddenly you've gained 2 kilos just before your periods. And if you see after a couple of days of your periods are over, you would see that you would have lost that weight. So that happens. That is very hormonal, and that is because of water retention. So that is something which we don't have to consider. In fact, when people come to us for weight counseling, we always ask them whether they are nearing their periods and stuff like that. So that is again something which gets added onto that period. So
Okay, in that case, I need to retake my BMI because I think I did put on a few kgs over there. But
yes,
this is very, very useful. But now moving on to the different part that obesity affects. I would like to start with the heart and obesity. How are these
yes.
two interlinked, and what are the possible dangers that are there?
Yes. So to start with, in general, human body is made for a certain weight, right? Now, as we go on putting on the weight, our organs, all our organs, whether it's the heart, the lungs, the liver, the joints, whatever you talk about, it's made to handle a certain amount of weight and certain amount of work. So the more our weight increases, more that particular organ's work also increases, right? It's common sense that if you make something work harder, that organ is going to get tired faster, right? So ultimately, when we are suffering from obesity, what happens is that there is a condition called as metabolic syndrome, which means that you have diabetes, type 2 diabetes, high blood pressure, high cholesterol, and obesity coming together. Now, all these four conditions have a direct effect on the health of your heart. Okay, so the longer you live with these diseases, the higher the chances that your health of your heart is going to eventually go down gradually. So that is why when you see that eventually everybody who suffers from diabetes does not really die of diabetes. They eventually die of, say, a heart attack or something like that. They would have a myocardial infarction or something to do with the heart. Everybody, ultimately, the heart has to stop working, for people. Anyway, we're getting a little bit depressing over here. But what I'm saying is that ultimately is the health of the heart, which is very, very important. And all these diseases have a direct impact on the health of the heart. And what is most important to remember is that the heart health, it is now said that even at a BMI as low as 24, you start developing risk to develop heart disease, right? So as your BMI goes up gradually, your risk of developing heart issues goes up considerably and in proportion to the gain in weight and BMI. So it is very, very important to keep your weight in check.
Okay. Absolutely. And, Dr. Bhaskar, since we're talking about heart, and this is a question that I've actually not had the courage to ask a lot of people, but I will still go ahead. What do you think is the correlation between taking psychiatric drugs for that matter? For example, I think not many of us talk about it, but there is a huge population that is taking drugs for mood disorders, antidepressants. There's lithium carbonate, there's sertraline, and there's all different kinds of salts which are used for treatment, and they're often said to increase weight, but I haven't been able to find the right kind of information. Do you think they also lead to weight gain? If yes, then what can be the
Yeah.
possible conditions?
So, yes, there are many psychiatric medications. Now, again, weight and mental health disease is a two-way thing. So, mental health disease, weight gain is very highly correlated with mental health problems. And when people have mental health issues, they are sometimes taking these medications. And a lot of these medications not only increase the weight, but they also increase hunger. They will increase the appetite, and they make a person eat a lot more. So when people are on these medications, they tend to gain weight. Now, I'm not really a psychiatrist, and I'm not an expert at these kind of medications. But yes, there are a certain group of antipsychiatric medications which are also weight neutral. But then it again depends on the severity of the mental illness, because at times the psychiatrist has to use a combination of drugs, and some of these may be weight neutral. But there would be some which may be not very weight neutral and may induce weight gain. And it's not only the drug which is causing increase in appetite, but there are certain drugs which may also cause a lot of lethargy, which may cause a lot of sleepiness. And then the person is not able to, they don't have the energy to go out or to work out, or to, they don't feel up to going and walking around and all that. So it all kind of adds up, and then basically leads to increase in weight gain. And then it's a vicious cycle. So they're not able to get out of those medications. The medications also increase the weight, and the weight basically increases the whole mental health issue as well. So that becomes a very difficult place to be in and to be treated for.
Yeah, you're absolutely correct. I think then it becomes like a terrible spiral where you're trying to fix one thing, but the other thing begins.
Yes.
And because and I think we came back to where we started. You said people with obesity actually get judgment.
Yes.
So we are actually going back to the same place.
Yes.
And unless we find a way to break it in the middle, which is understanding obesity as a disease,
yes,
which affects your entire body, there will be no difference.
Yes,
and I'm seeing.
I'm sorry to interrupt you, but I said I'm actually seeing a little positive change nowadays, because I deal with a lot of people who suffer from obesity, and they come for consultations. And of late, we've been seeing a lot of younger women who suffer from PCOD. Remember, we did a session on PCOD and body image, and I'm in fact seeing a lot of parents who've actually who are being less judgmental. And I think Anjali is logged out.
Yeah, sorry.
Yes. So I said I'm seeing a positive change in the sense that parents and spouses are actually less judgmental than what we think of them to be. And they are being a lot more supportive. They're seeking out help, and they are really supporting their children or their spouses, and really being quite helpful. So there are both kinds of people there. So, of course, I do understand that there are people who need a lot more help, and we need to bring in a lot more awareness, but we need to appreciate those who are already there, So that's one thing which I just wanted to bring about.
Lovely to hear. And I think also appreciation goes up to people like yourself and your team who are raising awareness. And I think there are people who are doing it, who are constantly, relentlessly working on it, despite the stigma that exists. And thank you so much for providing these insights. And I'm really happy to hear that there is change. Now, moving forward, we also talked about cancer and obesity. So if you could tell us, how does that relationship work? Because it has always been very baffling.
Yes, so I think cancer and obesity are very closely related, and of late there's been a lot of research, and a lot of new findings have come about, and especially for women. So the hormone-dependent cancers. So fat is one of the largest organs that produces estrogen in the body, right? So fat is another place from where estrogen is produced. And tumors which are actually estrogen dependent, so your breast cancer and endometrial cancer, which is basically cancer of the uterus, these are two main cancers which are actually dependent on estrogen. And obese women who are basically who suffer from obesity are very, very prone to developing breast cancer and endometrial cancer. Breast cancer, there are other things as well. Usually these women are heavy breasted. So if they have a small lump, self-examination, normally they're not able to feel the lump because of the size of the breast. Second thing is, because of the stigma, they are very reluctant and very hesitant to go out for a checkup, because they're so they don't want to show their body to anybody. It's very difficult to pick up on radiological investigations as well, because the breasts are large, and the small tumors can be missed out. So those are the other problems that exist with this. And usually the diagnosis is late. So obviously, if something is diagnosed late, especially something like cancer, then the treatment obviously becomes more difficult. Same thing with endometrial cancer. Again, it's very, very difficult to diagnose, and most of the times there are no symptoms. And many times we've seen that patients coming in for bariatric surgery, we've been working them up for a normal bariatric workup, and we do ultrasounds, and the ultrasound then reveals that this patient has increased endometrial thickness and then on further evaluation they get diagnosed with something like that. So these are silent diseases which are there, and which can be really very, very serious. So these are two main things. Then even colon cancer, that is again very highly correlated with obesity. Pancreatic cancer, these are again, and many other kinds of cancers again. So these are the common ones, but breast cancer and endometrial cancer are extremely closely related, and unfortunately, both of them affect women much more than this thing. So that is something to make a note of.
Yeah, and it's actually very morbid to hear about this, because I think I was actually reliant on self-examination, and now that you hear, because there are complexities, if the breasts are heavier, it becomes even
Yes.
worse. So, I mean, I think what would be the course of action over here? Is it regular checkups? Is it I think regular checkups would be that,
It could be
especially for
regular
women, I think.
checkup, and I think the primary cause here is obesity. So we need to be mindful of that, and we need to get treated for that as well. So we should not left that. We should not leave that untreated. Also, so by treating obesity, you would also bring down your risk of developing cancer. That's been proven as well. That if you treat obesity and you lose weight, your risk of developing cancer comes down considerably. And also your chances of getting treated, chances of getting diagnosed and everything also becomes much, much better. So definitely treatment of obesity is required for these patients. And also regular checkups. So these, I think, again, we need to work on body image issues, that your health is more important than feeling shy or being hesitant about visiting a doctor or getting a regular mammogram done. So these are things which need to be emphasized upon, and women need to have that kind of confidence to go out and get these things done.
Definitely. And that's actually why we also have been working on fuchsia wellness, because we realize there's so much shame in talking about one's body. And I think
Yes.
also shame, there's not the vocabulary to talk about it without sexualizing your body or without
Yes.
stigmatizing your body. So it's all the more important for us to have these conversations as openly as possible. And
Yes.
Dr. Bhaskar, now moving forward, I also have heard, and these are things I'm picking up from cultural connotations and everything, sleep apnea, and what could be the dangers and how is it related to obesity again?
Yes, so sleep apnea is again something which is very classical of obesity. And if what happens is basically that there is a lot of fat in this area, right? So people who develop a lot of obesity and they have a lot of fat in this area. So what it does is that it when a person sleeps, this fat chokes them during sleeping, and it kind of prevents them from breathing. So that leads to spells of apnea, or what you can say is they're not able to breathe properly, right? So this leads to a dip in their oxygen level. The second thing is that because there is so much fat on the abdomen, on the tummy becomes so large that the space for the lung reduces. So our lungs are like balloons. When we inhale or when we breathe in, the lungs will inflate like a balloon, and when we breathe out, so we are breathing out carbon dioxide, and we're breathing in oxygen. So when we breathe in oxygen, the lung will inflate like a balloon. And when we breathe out carbon dioxide, it deflates, right? But you need space for this whole exercise to happen. Because of obesity, there is a lot of fat which is built around your chest wall. Second thing is the whole abdominal fat is pushing the chest up. right? So the lung space decreases considerably, and there is no space for the lung to inflate, right? That is why what happens is that most of these patients who suffer from obesity, they kind of breathe shallow. So they are not taking adequate amount of oxygen inside. And when they breathe out also, they are not throwing enough carbon dioxide outside. So what is happening is you're taking in less oxygen and you are not throwing out all of your carbon dioxide. So you're retaining more of the toxic carbon dioxide inside your body. So this over a period of time keeps on building up. And you would see that some of these people actually come to our clinics, and during consultation, they go off to sleep. So you would actually wonder that this person is so rude that, they're sleeping when I'm talking to them, but it's not their fault, because it's because of the carbon dioxide. So the carbon dioxide makes a person very sleepy and very drowsy. It's not sleepy, it's drowsy. And that is what happens. And in very late stages and rare cases, it can actually lead to coma. So that is called as carbon dioxide induced coma. And that would be very, very severe case of sleep apnea. But usually, if they're snoring in the night, and daytime is sleepiness, daytime fatigue, very too tired. So these are the kind of symptoms that most of these patients would actually complain of.
Yeah, and I'm also thinking if this is in some ways also related to high blood pressure, because
Yes.
we're talking about this, and that's what actually immediately came to my mind. So could you tell us a bit more about that?
Yes. So what it does is that eventually this whole thing leads to a lot more pressure on the heart. So eventually it will lead to something called as cor pulmonale, which basically leads to failure of the heart in the last stages. So it could lead to right heart failure. And obviously, all this will manifest as high blood pressure and all the other problems as well. So, in the last stages of sleep apnea, which is very rare, it's not very common. But yes, heart failure would be one of the manifestations of severe sleep apnea.
Okay, got it.
Yes.
And with that, Dr. Bhaskar, I will come to my last question,
Yes.
which is I want to understand a bit more about blood circulation and obesity and how that gets affected, because I think that overall also covers the way our body functions, and what happens if we cross the threshold and are classified as obese. How does the blood vessels, and how are they affected in that case?
So, blood vessels are affected actually in multiple ways. Number one would be that obesity, there are multiple things which are happening in the body at the same time, right? There are multiple diseases that a person is battling. So, obesity makes a person prone to developing diabetes, it makes a person prone to developing high blood pressure as well, right? So, high blood pressure and diabetes are both conditions that affect the health of our blood vessels. They both lead to something called as atherosclerosis, which is basically thickening of the blood vessels and hardening of the blood vessels. Okay. That by itself is a precondition for developing heart related issues or heart attacks and things like that. So, that is one part of it. Second part of it is something called as tendency to develop blood clots. So, like now, recently, you must have seen that when COVID-19 came into our lives, so everybody started talking about clotting, right? It predisposed us to clotting. So, obesity is another condition, which is basically it predisposes us our blood to clot very fast. Okay, now we have an arterial system and we have a venous system. So venous system basically takes our blood back from the periphery to the heart and to the lungs for purification. Because of obesity, this flow of blood becomes very slow and sluggish. Okay, तो बहुत धीरे धीरे blood ऊपर जाता है. Anything which slows down in speed will have a tendency to clot. And in the leg veins, if this blood clots and this clot breaks and travels up to your heart or lung, then that could lead to it could lead to sudden death also. So this is called as embolism, pulmonary embolism. So this is one of the most common causes of sudden death in patients who suffer from obesity. This is called as pulmonary embolism, and we call this condition as a deep vein thrombosis. So this is one of the major complications. But otherwise, as I said, all the other conditions like diabetes, hypertension, and obesity put together lead to higher tendency to develop atherosclerosis. But deep vein thrombosis and thromboembolism is the other part, which is probably even more dangerous than the atherosclerosis part.
Okay, all right. So the way I see it in this conversation is that obesity is also, it's not occurring in isolation, right? It's
Not at
actually
all.
changing the physiology of your entire
Yes.
body. And I think it's high time that we understand it that way and also understand it as a disease with medical professionals such as yourself to, to treat it, to resolve the situation. And for anybody, I would also urge people to, read more from reliable sources. Dr. Bhaskar has her own website. You can also go over there or follow her on her social media pages. She's very active on LinkedIn and everything. But please do get the right kind of information about obesity. And with this, we come to the closing of this session. Dr. Bhaskar, my heartfelt thank you to you. I think you've been one of the most patient people that I have worked with and have gotten on these sessions with. You were really patient throughout the debacle that happened before the beginning of this session. And thank you so much for being so fantastic with your knowledge, with your attitude, and with everything that you have been doing for the community. And thank you so much to everybody who has joined. Thank you so much for being an amazing audience that you always are. I am now freezing. So we'll close this live session. Thank you so much, everyone. We'll see you next time. Thank you, Dr. Bhaskar. Goodbye.
Thank you. Thank you. Bye bye.